Good afternoon. I'm Pat Living with the Department of Health and Social Services. This afternoon we are joined by Yukon Premier Sandy Silver and Yukon's Chief Medical Officer of Health, Dr. Brendan Hanley. Following the updates from the Premier and the CMOH, we will go to questions. Today we will do 2 rounds of questions. We'll go through 1 round and then we'll come back around for a second. Thank you. Premier?
Thanks very much, Pat. Good afternoon, everyone. I do want to begin by just thanking all of Yukoners for being so very vigilant over the weekend. The weather was fantastic, and we know that spring is on the way. And as weather warms up, it's a perfect time to celebrate the spring with our friends and with our family. And keeping our distance this past weekend was particularly hard, and I understand that. But I am so very grateful that so many Yukoners did the right thing and stayed physically apart. According to the RCMP, there were less calls than normal over the weekend. Our emergency measures team also reported that for the most part, people were respecting the orders and recommendations, and this is exactly what we want to hear right now. So again, thank you very much, Yukoners. Your efforts are extremely important. This isn't easy for any of us, and there absolutely is a long road ahead of us. But by staying vigilant today, we will be saving lives, guaranteed. Every day, every weekend, we reduce this spread of COVID-19 by practicing physical distancing, and this is another day closer to getting to that place where we can all gather once again. So again, thank you very much. Our first priority as a government is protecting the health and safety of Yukoners. Our second priority is to support Yukoners and Yukon businesses through this difficult time. To date, we've announced more than $20 million in support available to businesses and to individuals, covering everything from 14-day sick leaves and house protection to waived fees and coverage of event cancellations, to cover rent and other fixed costs for businesses, and all that was announced over the last few weeks, and of course by Minister Play last week as well. I heard from many businesses this past weekend who said that offsetting fixed costs such as rent is a huge support for them that will be incredibly helpful as they navigate this situation. Thank you to everyone who has reached out with ideas and feedback about our existing programs. We are listening and will share future details as soon as they are available. We will continue to listen to Yukoners about what they need to weather this storm, and we will also take lessons from other provinces and territories right across Canada. We heard excellent news from the Prime Minister this morning. Federal government has allotted support money for the Northern Territories, which is very, very much appreciated. We have had many positive conversations with Prime Minister Trudeau, Deputy Prime Minister Freeland, and other ministers over the last few days and weeks. Today's announcement of further support for the North is appreciated and is in direct response to the requests that we have made. I have spoken with Minister Vandal and also Minister Joly about this money and understand that details will be coming shortly. Just got off the phone with Minister of Finance, Minister Morneau as well. So we will be sharing this information as it's made available. I would like to thank, again, the Prime Minister Trudeau and his team, in particular, Minister Morneau, Minister Joly, Minister Vandal, and also, last but not least, Minister Garneau. They have heard our calls for support and are working with Yukon to get money out the door and into the hands of Yukoners. I feel very fortunate to have a positive relationship with the federal government during this crisis. As our needs change, we will adjust our requests to the federal government and are quite confident that we will continue, that they will continue to offer support as the situation evolves and as we gain information from Yukoners. Once again, I really want to extend a heartfelt thank you to all Yukoners who are working every day through this pandemic. Whether you are a truck driver or a store clerk or maintenance, folks that are getting supplies to where we need, government workers that are developing these financial support programs, of course, our initial responders, our emergency folks, and the medical community, you're all helping to keep the territory running, and I appreciate all that you do. Some conversations seem to turn towards when the situation might change. We saw the media questions to the Prime Minister exactly saying that this morning as well. When will our economy might reopen for business and when we might lift restrictions that are currently in place. I know that this is something that Yukoners are anxious to hear about as well. My message for Yukoners right now is that we still have a long road ahead of us in the fight against COVID-19. We are seeing signs across the country that physical distancing is working, and that does give me a lot of hope in the territory. I recognize the hardships that everyone is experiencing by continuing with these restriction methods. And I'm certainly looking forward to the day when I can sit here and announce that they're ending. But we can't do it until it's safe. And we aren't there yet. So don't give up. Continuing to do the great work that you're doing, Yukoners. Rest assured that your government is listening and will continue to support you during these hard times. And if we keep up the diligence now, and I know it's hard, what a beautiful day it is right now in the Yukon. I know that this is the hardest time. People are wanting to get out, but the good work and diligence that we do now absolutely is saving lives. So thank you very much, Yukoners, for that. And I'll pass it off to Dr. Hanley now for his update.
Thank you, Mr. Premier. Good afternoon, bon après-midi. Welcome back, everyone, from what I hope was a restful and peaceful and sun-filled long weekend. It's been a while since we talked numbers, so I want to be able to talk about the numbers which we posted yesterday and where we are staying at 8 positive COVID-confirmed cases. We now have 6 recovered cases and a total, as of yesterday, of well over 800 tests. Bon après-midi, ça fait un bon moment que nous n'avons pas parlé de cas, donc je veux pouvoir fournir notre dernier chiffre, 8 cas actifs, 800 négatifs et un total de 6 maintenant récupérés. I want to revisit one of the themes we left off with before the Easter long weekend, and this is about providing more clarity on what is or what is not acceptable in terms of physical distancing and COVID preparation. I realize that the reason for some of the questions I've received relates to us being in a slightly different position here in Yukon compared to many other areas of Canada where community spread of COVID infection is documented. We know that testing will never be perfect and that cases may well be missed. But we continue to be confident that community spread has not arrived here. And we are pleased that to date, all of our confirmed cases are either imported or connected to imported cases. Furthermore, if community spread arrives, it is unlikely to hit us at once. Rather, it is something that will be increasingly evident as cases become disconnected from outside travel or known contacts. However, what could change from one day to another is the unnoticed person with COVID who might spread infection, causing an outbreak or cluster that could affect any number of people, perhaps a few, perhaps dozens. That is why we're asking for physical spacing now and not waiting for COVID to formally announce its presence among us. When contemplating any event or visit or gathering, think of it this way. If COVID were among us right here, right now, how can we prevent it spreading from one person to another? So without going into all the orders, let's review, therefore, 6 measures that we need to be observing right now. Physical distancing. We do this now not just for practice. It is observed so that if a person is unwittingly infected with COVID, there's little chance for the virus to spread to others. That means keeping 2 meters from others that are not from your own household. The second, wash your hands. Wash your hands, wash your hands. And did I mention wash your hands? Third, staying home and out of the way when you are sick, so that if that illness is COVID, or anything else contagious for that matter, you prevent others from getting infected. 4, limit any gatherings to under 10 people. The less that people gather, the less consequences there will be for the unexpected COVID-infected person. Think of it as the COVID elephant in the room. This can also apply to your workspace or your place of workshop. The number in that case may be more than 10 if the space is big enough. Safe spacing must be observed at all times within that space. The 5th is limiting travel to the communities to essential travel only, so that if somehow you have COVID, you will not be exporting it to places where we really do not want it. And 6th, self-isolation when you are required to self-isolate, either because you have been named as a contact or because you have traveled into the territory within the last 2 weeks. When you travel in, you must register and then go directly to your home or other agreed-upon place of self-isolation. Do not stop at the grocery store. Do not pass go. Do not collect $200. I'm going to repeat a little bit of that in French. Pour bien appliquer les principes des mesures sociales, pensez à ceci. Si la COVID-19 était parmi nous en ce moment, comment pourrions-nous empêcher sa propagation d'une personne à une autre? Voici les 6 mesures. Maintenir une distance physique, se laver les mains fréquemment, sinon toujours. Rester à la maison et à distance des autres si on est malade. Limiter les rassemblements à moins de 10 personnes. Éviter les déplacements non essentiels dans les collectivités. Et respecter les règles de quarantaine. As we continue on this COVID journey, we can develop lists for the type of activities that are okay and those that are not. But if there's one phrase we should become more comfortable with, it's even if you don't have to stay at home, stay close to home. We can never describe every scenario, but I think we'll all get better at judging which events carry too much risk at this point to continue. For example, a dinner party is just not a good idea. But 2 or 3 friends meeting over coffee while observing all of the above rules is okay. Kids playing outside while supervised to keep their distance is totally fine. Outdoors, in general, is a better place to carry out any social activity. Like the Premier, I could not help notice some of the good or surprising news over the Easter weekend. Locally, many people got outside and everyone seemed to have behaved and followed the physical distancing rules while outside. I think we hit that balanced, close-to-home approach just right. And it's also good news we have no further positive COVID as in the last few days. But as always, we will expect more cases, either as new importations or as cases related to current investigations. These are cases that, when characterized by people following orders and advice, are well within our scope and ability to manage. Nationally, we're seeing how Canada's curve is being bent and that some of the hardest hit regions currently may be starting to see a peak. This is indeed encouraging, especially when we're seeing more and more evidence accumulate of how effective the social measures that we currently have in place can be. We see Wuhan now celebrating as they start gingerly to open up their society again. I also thought how interesting were some of the more extraordinary pieces of good news amongst all the COVID angst and tragedies. News like murder and violent crime rates plummeting in Mexico and Central America. People in northern India seeing the far-off Himalayas for the first time in decades. Seeing stars for the first time on a night in New Delhi. Since the tourist throngs have diminished, the canals are running clear in Venice. And those stories of human solidarity and generosity continue to pour in. I hear mass virtual choirs and sing-alongs, free virtual fitness and cooking classes, free online Ivy League courses. People coming together, world-changing events. I wonder when all is said and done, could we be in for a global reboot? Climate change conversation, for example, has taken a backseat to COVID, but it is no less an emergency now than it was 3 months ago. If we can take inspiration and lessons on global cooperation to what we are learning from the pandemic, we can really be in a better place than ever before. And as we get more used to this way of life and more organized in our approach, where can we help to normalize our lives again? What can we relax or reopen? How can we maintain our health and ensure our health is being looked after? How can we better prepare ourselves for the long haul? The other notable event over the weekend was the 40th anniversary of that most Canadian of heroes starting his Marathon of Hope. Terry Fox started his daily marathons with a dip of his leg in the Atlantic Ocean on April 12, 1980, and ran for 143 days before he had to stop on that sad day in Thunder Bay. One of the oft-quoted COVID truths is that we are in this for a marathon and not a sprint. So can we adopt Terry Fox's determination as we progress in this pandemic marathon of hope? Nous tous aussi, nous pouvons nous inspirer du courage et de la détermination de Terry Fox, non seulement en refusant de baisser la garde et en restant vigilants face à l'invasion de la COVID, mais également en contribuant à répandre la bienveillance et à créer un monde meilleur, une fois que nous serons de l'autre côté de la courbe. Terry was a kid with incredible courage, spunk, and wisdom beyond his years. At one point, he remarked how cancer had made him a better person. He said, "It has given me courage and a sense of purpose I never had before." We likewise can emulate Terry's courage and sense of purpose as we not only maintain our guard and stay vigilant against COVID invasion, but as we do our parts to spread kindness and work to create a newer, better world on the other side of the curve. Thank you.
Thank you. We'll now go to questions. Again, a reminder, we'll do one round of questions, so one question and one follow-up, and then we'll go to a second round. We'll begin with Tim Kachernik from CKRW.
Hi, good afternoon, Dr. Hanley. I'm just wondering, just looking at the numbers, and I was looking at Skagway's numbers the other day. They have a feature on there where they have, with all their numbers, they have where it lists the amount of test kits that they have available for the community. I'm wondering if you would consider putting this line item kind of as part of the list so that Yukoners can get a sense of how many test kits we have available.
Tim, that's a good question about numbers of test kits available. I think I would be a little bit careful about answering that, though, because the situation in Alaska in terms of test kit availability, as in the United States, has been quite different from Canada's. And we are not facing a test kit shortage. We have plenty of swabs. And as you know, our tests go out to BC for testing. Our bottleneck, if anything, is not the kits and it's not the lab capacity, which has ramped up considerably over the last several weeks in BC. It's really the transport. So we are in a very comfortable position with testing turnaround at the moment, and where we get any delay is really related to the flight schedules. But with the putting all that together, I think if we were to talk about test kits, it's almost, we are such a our amounts are so tiny compared to the big pool of test kits in BC. We really it becomes not a really significant number. I think what is probably more important to look at is pending results, because that gives us a good idea of how many tests are still in the lineup waiting. And as you can see, that has dropped from several hundred to now in the teens, and that's really where we want to keep it as low as possible numbers of pending results, meaning that our turnaround and processing times are actually doing well.
Okay, and just to follow up here, Alberta today kind of lowered their threshold for testing, pretty much saying that anybody who has symptoms can get a test. I know I've bugged you about this in the past. Are we getting to that point? You said we were heading in that direction last week.
What we're looking at is a testing strategy that looks at not just symptoms, but vulnerability. So our focus right now is on where does it matter most to know where COVID is occurring. And I can tell you those areas are rural Yukon, long-term care or continuing care, and certain other environments with vulnerable populations. So those are the areas that we're looking at right now. And in the days ahead, starting to test with lower thresholds in those areas. I think it's really important, again, to distinguish our situation from Alberta's. If we were in Alberta's situation with community spread, significant community spread, then we would have to alter our testing in accordance with that. Right now, what we're looking for signals. And there's a number of strategies looking for signals that are actually higher priority than just testing everyone. Sometimes if we test everyone with symptoms, it can lead to too much noise and not enough signal. So we're really focusing on a strategic approach, and I will bring you more as we have more coming online on that.
Thank you. We'll go now to Amy Smart, Canadian Press.
Hi there. My question's for the Premier. You sound pleased with the funding that was announced today. I'm just curious, I know some others have expressed some concerns that it may not come quickly enough. I'm wondering if it meets all of your needs, or if there's things that were on the table that you're still interested in getting support for.
Thanks for the question on federal support. You know, we've been working hand in glove in communications with the federal government, and you know, when you take a look at a Venn diagram of local supports and then the federal supports and a coordinated effort, a collaborative effort on those supports, I'm happy with where we are in twofold. Federal government will make an announcement one week, and then the next week following, the flexibility of those dollars increases based upon the input from the jurisdictions, the provinces and territories. So extremely pleased with that. Very pleased with the direct contact, not only to the Prime Minister's office, but the Deputy Prime Minister's office and all of the ministers. It was Minister Jolie who, in her statements on today's funding announcement, talked about exactly that collaborative nature that we do have, and making sure that as the local regional governments who really know best how to focus funding, whether it be for small businesses or Yukon individuals, and how the federal government can then come on top and collaborate and complement the directions and directive from those governments. So, is it enough? It's a lot for now, but you know, the federal government has agreed, and we've said this as well. You know, that may change in a week. We have needs that are going to change. You know, we're in really uncharted territory in that for the first time a lot of people are seeing that reduction of the curve, and where I'm cautiously optimistic about that, I still do worry with the good weather and, you know, changing behaviors. And, you know, again, if we stay the course, then, you know, we are well prepared to get through this to the other side. If we don't stay the course, well, that brings a whole bunch of other financial issues as well. We are also pivoting our direction towards businesses. You know, our number one responsibility of reducing the curve and reducing the strain on the medical system. But we also need to make sure that we have a lens to that long-term, a lens in the long term that includes as well our economic considerations. So happy to see federal funding with CanNor, which matches up with our funding relief for small business. Good to see some aviation dollars in there. The details are being worked out as we speak, and of course the lump sum, $17 million for healthcare, couldn't come at a better time. I'm sure Dr. Hanley will agree on that. As when you take a look at all of the preparation work that the Department of Health and Social Services, the Hospital Corporation, and Dr. Brandon's offices have done, we are moving through a lot of our budgetary money already, and that support couldn't come at a better time.
Do you have a follow-up, Amy?
Thank you.
Any follow-up?
No, that's fine.
Okay. We'll go next to Jane from CBC.
Hi, my questions are for Dr. Hanley. And they're along the same lines of Tim's about testing. As of yesterday, there were 832 tests done, and about 2 weeks ago, there was just under 700. So it seems like maybe the rate of testing has slowed. And is that the case, and why?
The question is about the rate of testing. So yeah, keep in mind that we are still by far one of the highest jurisdictions for testing rates per capita in the country, and we continue to encourage testing for the both for the written indications, plus when physicians have other reasons to test at their own clinical discretion. And as I said, we're also looking very actively this last week and this week at where we need to test to just pick up any signals of community transmission that may be missed through our traditional testing. So now so what you will see is fluctuation in the numbers, really depending on numbers of people traveling into the territory. Now, I can't give you figures right now on numbers who have traveled in, but I imagine that we were dealing with higher numbers of people who had traveled in when we first applied these testing criteria to now, as people are staying more in place. So that would likely reflect exactly what we want, is that people are staying in place, not traveling as much. The risk, therefore, of importation is decreasing, but that will also reflect a certain amount of decreasing in testing rates that are applied to those criteria. So now that we're in this more comfortable position is the time, as we say, to look at expanding testing criteria according to, again, where we think the most vulnerable and where where it's more important to detect any signals of community transmission or other areas where the traditional testing may have escaped detection. So far, though, all of the cases that have been detected, all 8 or their contacts, again, have been the ones that we've caught through the rigorously applied testing criteria: travel, contact with a known case.
Do you have a follow-up, Jane?
Yeah, and what would be a signal of community transmission? What would stick out if there was any community spread?
Sure. So it's when do we know that community spread, or when do we suspect that community spread is occurring? And that's when we can no longer trace a case to another case or to travel. So if, for instance, now we have, let's say we had a positive case tomorrow that we couldn't detect to travel from elsewhere in Canada or international or to a known contact, then that would be a possible signal of community spread. So then we of course, as always, draw the circle of contact tracing around that case. Look for other people who are contacts who may develop symptoms. Do our usual case contact. So even if there was a signal of community spread, it wouldn't necessarily mean that it's now all over Yukon. We would still be containing that case and managing any clusters associated with that, but that would be an early signal of possible community spread.
Thank you. We'll now move to Gabrielle at the Whitehorse Star.
I'm hoping that you can provide some more details about where the federal allowances for medical support are actually going. You noted that the budgetary money is we've moved through a lot of it recently. So what are some of the more costly things that we're looking at, and where will that funds go immediately?
So again, the question is on the federal relief package today. We don't have any more details right now on specifics of the federal dollars, although we are happy to report that the decisions for the allocation of those resources comes from the information that we've been sharing, either be from Health and Social Services Department, Economic Development, community services. Those are the three main departments that are really outside of my office of the Executive Council and Department of Finance that are really in the trenches of communicating with Yukoners, whether it be businesses or other leadership, to get the information that we need and then parlay that into federal relief dollars. So there, again, as I say, I just left a meeting where we were working out the details with the Minister of Finance, and I know that the Department of Health and Social Services is also working on the details, as is the Department of ECDEV when it comes to CanNor's announcement and how that complements what we've announced last week for support for businesses.
Okay. We'll move to Jackie at the Yukon News.
Hi. My first question is, some jurisdictions have made it an order or a bylaw to maintain 2 meters distance between people in public spaces, enforceable by fines, etc. Is there any consideration of introducing a measure like that in the Yukon? Is that something being looked at all?
I presume that's a question for me. It's about enforcing physical distancing and whether that should become an order or not. So I guess the standard response is nothing is off the table, and the possibility is there. It's not something, however, that I'm contemplating in the near future, and I think it really goes back to what is the confidence that we have that it's occurring. And based on the observations that we're making, and again, with continual encouraging of people and pointing out the rationale behind it, I think almost to turn it into a daily habit rather than bringing the hammer down, I think is the preferred approach. So as long as we see progress in that direction, which we are, then I see no need to make it into an order. Now, if we started to see a dropping off, that might need, we need to increase the supports, the communication, or look at enforcement measures. And also, it may become more imperative if we were in a different phase of our pandemic. For instance, if we were seeing community spread, that might bring more urgency to making it mandatory. But at this stage, we're seeing good compliance, we're seeing really good cooperation, and we continue to promote it, and we will continue in this way.
Silver?
Yeah, and just to add that, as you know, we do have the Civil Emergency Measures Act, and within that there are fines, including jail sentences, for those that don't comply to the orders. So we also have measures in place right now. But I do want to speak to, the enforcement piece. This weekend was beautiful out. The RCMP were out en masse, looking in on Yukoners, and we only received, and people are being vigilant, very vigilant, and we've only received 5 complaints all weekend long, and no fines were given out either. So with a heightened sense of importance from folks like the RCMP and our governments working together in that capacity, what we're seeing is not only Yukoners being diligent in their own behaviors, but they're also watching out for others as well. And to have an area like the Pass, which was usually extremely busy, We had RCMP presence out there until they figured, well, we don't even need to be here anymore because there's not enough people. And the folks that were there were absolutely complying with the orders. So again, we will continue to monitor the situation. Again, that cautious ease or cautious optimism about the curve being reduced. We do have fines in place, and we do have the enforcement out there as well, and we will continue to monitor that situation.
Jackie, do you have a follow-up?
I do. First off, Premier, you mentioned the pass. Is that the White Pass or the Haines Pass? And secondly, we've been hearing anecdotally from people that they're noticing more BC, Alberta trailers, campers, RVs, even some with EU plates passing through. With enforcement at the borders, is there any evidence that there's actually more or any travel into the Yukon happening right now?
So again, as far as travel in the borders, it's hard to compare to a couple of weeks ago when we didn't have the enforcement provisions in place. But now, cars are being stopped and you're being asked what your business is, and you have to sign on to your plans. And we believe that having folks at the borders, giving the information in this jurisdiction compared to the jurisdiction they're coming from is extremely important. We also know that, Yukon is a place where a lot of people are coming home from other jurisdictions. And, some of those plates that you're seeing are folks that do spend their time in both jurisdictions, different jurisdictions, including the Yukon. We believe that the enforcements that are in place right now are working based upon the results that we're getting as far as cases and no community spread. And we, again, will continue to monitor those situations. When talking about the pass, I was talking specifically about Haines. But we did, talk to Premier Horgan. I've talked to the Governor Dunleavy as well about in BC they did closures of parks last week, which was great because that definitely helps us out with weekenders. But also making sure that folks have 24 hours to get directly through to Alaska is extremely important as well. So I think a lot of people are noticing plates this time of year. I think people are looking for plates this time of year for sure. But I do think that the provisions that we have in place right now are keeping Yukoners safe, and having the ability to enforce that with fines and with even jail sentences is necessary. But also it's important to note that over this weekend we saw a lot more people abiding by the rules, and that's really good to see.
Thank you. We'll move on to Marin Roboreal.
Oui, merci. Vous mentionnez que une question en français. Vous mentionnez que le plus gros risque, c'est les personnes qui reviennent au Yukon, les résidents du Yukon. A-t-on un moyen de savoir combien de Yukonais ne sont pas encore revenus?
The question, I'll repeat in English first. I think the question was, is there a way to know how many Yukoners have not yet returned to Yukon? Le nombre de Yukonais qui ne sont pas encore revenus au Yukon, est-ce que c'est ça?
Oui, merci.
So that's not a question I can answer. I don't know if we even have a way to answer, but we can certainly take that and...
Yeah, we can take a look, but no, I mean it's very hard to determine that. Again, a lot of transient workers do come to the Yukon, but it's definitely it would be very hard to have those numbers right now. One example would be if it was a large season for the mushroom industry, for example, and comparatively to different years, and you wouldn't know how many people are going to come up for that or not. Again, right now is not the time to be coming up, but no, there's no way of being able to track those numbers right now, but we could definitely look into that.
Marin, do you have another question? As-tu une autre question?
Yes, I would have another question. Certains pays ont limité les ventes d'alcool afin de diminuer les violences domestiques. Est-ce que c'est quelque chose que le Yukon pourrait envisager?
Donc la question c'est pour si on contemple, on pense de réduire la vente à l'alcool, par la cause de violence domestique. The question is about whether we are contemplating reducing alcohol sales in view of an association with domestic violence. Donc, je peux dire pour le moment, c'est une question assez compliquée parce que si on réduit la vente d'alcool, on a aussi des conséquences pour ceux qui sont face à l'addiction d'alcool, qui prend l'alcool comme une mesure de survivre et qui va être en menace de détoxification ou d'une maladie associée avec une perte d'alcool dans le système. Donc, pour le moment, on pense que la vente d'alcool, en fait, ça joue une mesure très importante dans la société, même que ça doit être balancé contre le risque sous les mesures de sous-isolation d'une augmentation de violence domestique. C'est une question compliquée. On a un groupe qui sont en train de voir tous les besoins des populations plus à risque, si c'est pour l'alcool, pour les opioïdes ou pour la violence. Donc, et on va voir toutes les mesures qu'on peut avoir pour protéger les populations plus vulnérables. Just to say a little bit in English, the question of reducing alcohol sales to reduce domestic violence is, I think, a very tricky one, and I don't have a straight answer for that. I think it's because to some extent the sale of the continued access to alcohol is actually important for those who have addictions to alcohol, for those who depend on alcohol. For reasons that may not be ideal, but have a very practical way for that person to survive, and who may face issues of alcohol withdrawal and problems associated with that on the other side. So we are trying to take a more global, holistic look at the needs of certain vulnerable populations, including those at risk for domestic violence, and see what other measures we can have to support people during a very difficult time when we acknowledge that there is a risk for increased domestic violence.
Thank you. Okay, that brings us to the end of our list, so we'll actually run back through again. If you don't have a question, please let me know, and we'll move on to the next reporter. Tim from CKRW?
Thanks, Pat. Dr. Hanley, just wanted to talk about the self-screening tool for a second here. Just received a concern, actually, from someone just wondering why Ontario's and BC's self-screening tool was so different. Why is Yukon's page limited in terms of officially recognized COVID-19 symptoms?
So again, I think it reflects where we are in the pandemic, and where the key symptoms that we are looking at to make sure that we're targeting those who are at highest risk, being that we're looking for signals. At the same time, as I say, we are looking at possible revisions to criteria among many other ways that we test. So, including sharing experience with or learning from the experience of other jurisdictions. But when you again, I would say our focus for the moment is on priority populations, including rural populations. While not strictly changing the criteria, but looking along the same criteria for where we might see COVID pop up unexpectedly. At the same time, we have also for when physicians are seeing patients, and they have a suspicion based on the symptoms that they're seeing that they might be seeing COVID, and even though it doesn't fit the official assessment criteria, we allow, of course, that physician judgment, just as we always have, to again allow for those unexpected cases. So we continue to monitor and continue to review testing criteria and make sure that we're not missing signals, but that we're also being very strategic about how we apply those. I think the thing is, every time you open up the symptoms, as I said before, you also increase the noise, and so we're really trying to look for the best, most strategic way to do our testing.
Thank you, Tim. Amy, Canadian Press. We'll move on. Jane, CBC.
Yes, I have a question about the respiratory center. Since it's opened, have you seen many people, or do you have any sense of how many people have been going to the respiratory center?
So I'll take that question about numbers of visits at the respiratory center or the RAC in Whitehorse. I haven't seen recent numbers written down. My understanding is that it has been pretty quiet in the last few days with relatively low attendance. I think there are a couple of things going on. One, and it actually also relates to the question about why are we seeing decreased testing, but we're seeing less influenza than we were a few weeks ago. So there's less of that influenza-like illness around. And as well, we for the other reasons, we aren't therefore seeing a lot of people overall with respiratory illness, including those who screen in for testing criteria. Now the RAC is set up to see people with respiratory illness, regardless of whether they screen in for COVID or not, but who are advised after a call that they should get some medical assessment. But I think it just reflects that we're kind of at a quiet time overall in terms of, a quieter time, I should say, compared to to a few weeks ago when we had a lot more influenza and other respiratory illnesses in the territory.
Gabrielle, Whitehorse Star.
Hi. About a week ago, I think you mentioned that we were looking to procure more personal protective equipment. I'm wondering if there's an update on how that's going.
Yeah, I can give you a kind of a general update where, PPE is a continually fluid, I would say, issue where we are confident about good supplies. There was in the news this morning, it talked about the donation of 12,095 masks from Suncor, for example, as in adding to the current stockpile. We are in the process of centralizing all of our PPE inventory and therefore being able to centralize our guideline advice on when to use what PPE and in turn be able to better estimate burn rates and ongoing inventory. So we are in a good position for now and for the weeks to come. But it's always with some trepidation. I say that because we always want to make sure that we're maintaining a position, and that includes proper use of PPE so that we're not thinking because we have good supplies that we can use all kinds of PPE or overuse PPE. It's a continued balance between rational use to keep our healthcare workers safe, and the best way to keep them safe is consistent, rational use of the PPE that's right for that type of patient encounter, whether that's a higher risk for COVID or a COVID-infected patient or low-risk patients. So having that consistent approach to PPE use in combination with reasonable supplies, both now and ongoing supplies, I think we're in a good position. But it's something we literally review every day.
last week we thanked the federal government for, when considering PPE supplies, to not use per capita basis when they're allocating those resources, and we successfully got a base plus model, which takes in the consideration of the North when supplying nationally these extremely important supplies.
We'll move on. And I lost where I was. Jackie,
That was
right?
Gabrielle.
Okay, sorry.
My turn?
Jackie at the Yukon News.
Hi. For non-essential travel to the communities, can I assume that you're treating that the same way as physical distancing, where if needed to, it could become an order, but at the moment compliance is good, so we don't need to go there yet?
And just on that, I would urge anybody to take a look at the guidelines that are on yukon.ca, a wonderful document that really puts everything down in perspective. A lot of the calls that I get personally, I will direct people and go through the pages of that document, because it basically lays out a lot of the situations between essential versus non-essential travel and supports and businesses.
Okay, if we can move on to Marin, Aurore Boreal.
Merci. Avec l'annonce que vous avez faite que l'école en personne était annulée, que l'éducation va continuer maintenant grâce aux méthodes technologiques, est-ce qu'on pourrait avoir un update, une mise à jour sur comment le système Internet fonctionne pour le Yukon? Les jeunes et les parents vont devoir travailler avec Internet en même temps. Comment est-ce qu'on envisage ça?
So I'm going to translate that for the Premier. And the question was about an update since the announcement to suspend face-to-face classes. Has there been an update? Is there an update on the availability of internet and online training and courses? And for my own part, I can't. That has to come from education, so I can't directly give you an update. I know they've been working very hard at making those classes and learning plans available.
Absolutely. It's definitely been a huge effort from the Department of Education. I want to thank them for all of their efforts in making sure that we have continuing supports. Nothing new to announce today, but our most recent announcements and the parameters therein are all on yukon.ca.
Okay. We've Claudiane, can you?
Thank you.
Are you there? Claudiane from CBC. Okay, she's actually texted in a question in English. Are those traveling through to Alaska or NWT being tracked?
Yes. So again, when you are at the border, you are stopped and asked what your travel plans are, and from there, the folks are given 24 hours to get into Alaska, and they are signed off at that point.
Dr. Hanley, I wonder if you could repeat the answer in French for Claudiane.
Oui, la question c'était si les individuels qui viennent au Yukon et qui voyagent pendant les 24 heures qu'ils ont pour aller en Alaska, s'ils sont suivis. Et comme ils sont enregistrés, oui, ils sont suivis.
So if they come through with symptoms, does that change? Are they required to stay here?
So si la question s'ils arrivent avec des symptômes, c'est une partie de la question. Hein. Et donc, si ils sont, je ne sais pas exactement le script ou les mots qu'ils ont pour diriger les personnes. Mais s'ils arrivent, par exemple, pour avoir les symptômes, ils sont effectivement dirigés. Ça peut dépendre s'ils sont, lesquels sont les symptômes et s'ils ont les moyens de continuer direct en Alaska, par exemple. Si les symptômes sont par hasard sévères ou s'ils ont besoin d'aide, donc à ce moment-là, il y a un contact avec les officiels de santé pour voir ou de donner conseil s'ils sont sûrs pour continuer le voyage ou s'il faut voir quelqu'un sur place.
Okay. She does have one more question, and I will read it since she wasn't able to get through on the line. Her other question is whether Yukon could obtain medical equipment as an agreement with Ottawa or elsewhere.
So the question about obtaining medical, I guess the question is apart from PPE, is there other medical equipment that might be a part of a federal agreement? So, for instance, there is a federal process for ventilators, for access to ventilators. And I believe to supplies associated with ventilators. There's also a federal process for diagnostic equipment, such as point-of-care diagnostic, which, again, those are conversations that we are deeply involved in. I don't know if, Mr. Premier, you have...
Yeah, this is definitely a part of the conversation that we have on a federal basis all the time, and that's the coordination of supply nationally, and making sure that our ability to coordinate efforts makes sure that supplies are being procured in areas of need. And that we spoke last week about how heartening it is to see right across the nation provinces helping each other out. Folks that have a stockpile that aren't in the certain situation that other jurisdictions are in, and being able to transport those supplies over, knowing full well that it will be that province's time or turn later on. And it was also part of the conversation as to whether or not a national state of emergency would need to be declared based upon the procurement of medical supplies. It was the opinion of all premiers that right now the provisions in all of the individual regional acts and measures was enough, and also the coordination that we're seeing right now amongst jurisdictions also gave everybody a really good sense that we don't need a federal oversight on that procurement now. But at the same time, the federal government is paying close attention, not only to the need in the jurisdictions, but also to the asks of the premiers in all regions.
Thank you very much. That ends today's media update.
Thanks, everybody.